From IBM.TV World Headquarters in Raleigh, Durham, North Carolina, we present the Health Channel with ANKIT. Hi, I'm one of your hosts, Nick Palavita, along with Kim Calhoun, one of our co-hosts. We have the head of the Health Channel, ANKIT Kandlawar from New Delhi, India, with a very special guest, Dr. Saggu, also from New Delhi. Dr. Saggu, welcome to the Health Channel.
Yeah, thank you so much, Nick. Thank you so much, Kim. Thank you very much, Ankit, for inviting me.
Welcome, sir. Welcome.
Well, yeah, Dr. Saggu, tell us a little bit about yourself, where you're from, where you studied, and what you do.
Yeah, I'm Dr. Saggu. I'm working as a director of Department of Minimal Access and Bariatric Surgery, Apollo Spectra Hospital, New Delhi. I'm a fellow of American College of Surgeons, Chicago. I'm a fellow of International College of Surgeons, Chicago. And I did my fellowship from Agents Indian Hospital, Brugges, Belgium. So I studied my initial medical school from India, SMS Medical College, Jaipur, then Government Medical College, Amritsar. And after for super specialization, I went to Belgium and Chicago. So now I am full-fledged bariatric surgeon, working as a director and heading a department there in Apollo Spectra Hospital.
Okay, tell us a little bit about. That's a lot of education. Tell us a little about what is bariatric surgery, or what you do. What is that?
Yeah. Bariatric surgery, it is a division of the surgery which deals with the obesity and obesity-related comorbid condition like diabetes mellitus, like hypertension, infertility, obstructive sleep apnea. So, you know, when the patient is obese and the patient is more prone to have all these conditions. So you can say the obesity is a tree and which give you a lot of fruits, and they are not good fruits, they are the bitter fruits, like all these conditions, and we have to deal all these conditions. So if we can cure the obesity, you know, the obesity is not a lifestyle disease. Now it is proven a complex disease which give rise to a lot of ill health conditions that are not good for the long term. So we need to cure the obesity and we need to resolve all these conditions. For that, we have a bariatric surgery.
And just how long you are doing
Okay,
the bariatric
just
surgery?
another question.
Yeah.
Go ahead.
Yeah.
Since how long you are doing the, yeah.
I am doing the bariatric surgery since last 13 years.
Okay, and how many surgeries you have done in those 13 years?
I have done more than 1,500 surgeries, bariatric surgeries, and more than 30,000 other laparoscopic surgeries.
30,000?
Yeah.
Wow.
Wow.
So
you know when it comes to the practice or the research work or any other work in the field of medical, I think India is the best place because we are densely populated and we have a lot of patients. Even my colleagues from US, from Australia, they are coming here and they say, "Wow, I mean, it should not be said that we have a lot of patients over there. So we have a lot of opportunity to build our skills over here."
Right.
Wow.
And what is the obesity rate in India? Like in the United States, it's 40%. What is the percentage in India?
Yeah, it is around 40 to 50%. 40 to 50% is there. Yeah. That includes obesity plus overweight, both the conditions, not only the obesity.
Right. Okay.
Yeah.
I just don't think I've ever met anyone overweight from India, though. It seems like the diet are so good and the food is so good. I find that hard to believe, but wow. What has that been a recent uprise?
Yeah, yes, we can say it's a good food, but it's not a healthy food.
Oh, okay.
We have a habit, we have habits, but we don't have a good habits.
Okay.
We are modern, but we are not doing any physical activities. So we are going into urbanization, we are going into the westernization. So as we go towards the urbanization, we are leaving our habits back, and we are not doing any physical activities. So that is why the obesity is coming up and up. So earlier India was known for the starvation. The people were dying because of the starvation, but now the people are dying because of the obesity. So the completely the scenario has changed now.
It's changed. Wow.
Yeah,
Wow.
Okay. So fitness becomes pretty important then, would you say, Dr.
it,
Saggu?
yeah. Fitness is very important.
Mhm.
That will give you extra years of your life,
Great.
and not only the quantity of life, the quality of life as well.
So
Okay.
let's talk a little bit about some of the surgeries that you're doing. That's a lot of surgery. So I'm sure that you have developed a lot of new techniques, maybe even some new equipment, which, I've actually had a doctor one time experiment with new equipment on me. So tell me a little bit about what is happening and evolving today.
Yeah, in the field of the bariatric surgeries, earlier these surgeries were known to be done by the open techniques, right? Before, I'm talking about before 1992, and after that the laparoscopic technique has been evolved, and now all the surgeries are being done through the laparoscopic technique. And the laparoscopic technique is a minimal access technique where we use only 3 or 4 holes, or single incision we have only one hole. So through the one hole, through the 4 or 5 holes, we do the whole surgery.
Oh,
And there are number of the surgeries in the bariatric category. Like there earlier we used to do the gastric ballooning, but now we stopped doing the ballooning. There is a laparoscopic sleeve gastrectomy, there is a banded sleeve gastrectomy, then there is a Roux-en-Y gastric bypass, and then now the emerging procedure is the mini gastric bypass. So mini gastric bypass procedure is giving good results in the view of the diabetes, also in the view of the weight loss also.
what are I guess the bypasses? Those are in the past, even though we've had done so many of them. What are the rates, the survival rates now? I'm sure they've improved greatly with what you're doing, especially if you're not using the balloon anymore.
No, because the balloon has a lot of complications.
It
There
does.
is irritation of the gastric mucosa, and it leads to a lot of vomiting. And a lot of patients, even they get it removed within 48 hours.
Okay.
So the tolerate some of the patient, they cannot tolerate the balloon properly. There is a lot of nausea, a lot of vomiting is there. Even in the long run also, there is a lot of complications. Doing, but yes, other procedures are on. The gastric bypass, the gold standard nowadays.
Okay.
Okay. All
So
right. And
that
Kit.
Yeah,
was a needed change in process, much needed change in process.
yeah, yeah.
So is that a
And
practice that they're doing in the United States now? You bridge the two worlds, right? You're in Chicago, or you work with a fellowship in Chicago as a fellow, and you work in India. So are you bringing some of those practices here?
Yeah, I did some surgeries in Houston, also in the Texas, and some surgeries. Actually, I do my OPDs in some of the countries, like African countries, also some other countries also, and we use the same guideline as they're acceptable globally. Also, the international guidelines we use of IFSO, that is the International Federation for Obesity and Metabolic Surgery. So we are going by the guidelines of IFSO, that is internally accepted. So now whether it was or the same for Thailand,
My question is about obesity. So when you talk about obesity, at what weight you say that that person is obese, and to prepare the person for the bariatric surgery, what are the precautions you take care for pre and post surgery?
if we take the criteria for the bariatric surgery is the body mass analysis, that is the BMA or BMI, body mass index. So the guidelines is if the patient has a BMI of 32.5 or more with diabetes or any other condition, that is the indication for the surgery. And if the patient don't have any other condition, only obesity, and the BMI is more than 35, then there is indication or the patient is a candidate for the bariatric surgery. So before the surgery, we have to take care of a lot of things because this is a multidisciplinary teamwork. We need to evaluate the patient for all the organs. Like we do the cardiology workup, we do the respiratory workup. My physician sees the patient. We have to take a consultation from psychologist also, dietitian also. So as the overall, we have to evaluate the patient. Plus, my anesthetist see the patient and see for the whether the patient is fit for the surgery or not. So all these things is being done before going for the surgery, and specifically, we prepare the patient for the surgery by giving liquid diet for 5 days before surgery and some injections to prevent the deep vein thrombosis. So overall, we prepare the patient. At least we take around 2 weeks to prepare the patient, and then the patient is able to enter into my operative room.
And are there any
So
post-surgery?
optimization of the patient is very important. So if you have optimized the patient very nicely, you will have a very good result post-operatively.
And are there any post-surgery concerns in relation to the, health for the patient in future, or are there any side effects or, eating habits or pills they need to take care post-surgery?
Yes, yes. I mean, you can say the 50% work has been done by the surgery, and the 50% has to be done by the other things. The patient needs to be in the follow-up regularly. Patient has to follow the guidelines of the consultant, and from my office, the guideline has been issued to the patient. And yes, there is a definitely change in the eating behavior, change in the eating contents, change in the eating techniques, and everything we explain to the patient. My printed diet chart is being given to the patient, and some physical activity also. I involve my patients in some physical activity so that they can tighten their skin also, and they can have a good weight loss.
And what kind of age group do you see a patient coming for the obesity? I mean, is there any particular age group or
Oh, I have operated minimum 14 age, and I have operated recently at the age of 79. So, if the patient is fit for the surgery, for the anesthesia, and definitely, and the patient requires the surgery, then he or she is a candidate for the surgery.
and how much percentage of weight or pounds they lose post-surgery?
Yeah, we calculate it by the excess weight loss. So, your actual weight loss minus your ideal weight, and the excess weight is there. So, on the basis of that excess weight loss, we see, and I have seen my patient losing around 90-95% of their excess weight.
Wow.
So that comes to be, you can say, 30 to 35% of total weight.
So it's a gradual loss, or it's happened instantly
It's a
post-surgery?
it's a yeah, it's a gradual loss. Initially, patient loses slightly on the faster mode, and slowly and slowly, he or she loses weight on the slow mode. So it takes around 1 year to 1.5 year after the surgery to lose or to reach up to the targeted weight.
And we have also heard that some of the patient lose their diabetes or other small basic diseases post-bariatric surgery.
Yes, definitely. The initially it was not known, but now it is a metabolic surgery. A lot of patients they stopped taking insulin, they stopped taking their medicine for the diabetes, they stopped taking their hypertension medicine, they stopped using even the BiPAP machine, breathing machines they use for to sleep. So definitely now this is being known as a metabolic procedure. It is known as a diabetic surgery. It is a diabetic curing surgery.
And does the
There is a
patient
lot of
lose
effect on the diabetes.
the immunity as well post-surgery, or is there any ways to rebuild the immunity?
Question.
It depends on the patient. If the patient is following the doctor's advice regularly and coming to my OPD and taking all the supplements and the proteins, they're very important. So if the patient takes the supplements nicely and patient takes the protein shakes, And I think, which I have seen my patients, the immunity is going up. The patient is becoming more immune, immunity is going up, even their energy efficiency is also going up, their work efficiency is also going up. So overall, there is a definitely lot of improvement in the patient's total health, quality of health.
And does the patient come? Go for the surgery as a cosmetic surgery, or it's more of a requirement for them.
Cannot see the cosmetic surgery because we are going to cure the obesity. So it is to lose weight and to
Okay.
get rid of all the comorbid condition associated with the obesity.
No,
Because
why
after
I'm
that you are going to lose your skin. There is, if you are not working out properly, if you are not taking good massages, if you are not tightening your skin, then definitely you are going to have loosening of the skin. So it is not a cosmetic surgery, but we can say it is a life-saving surgery.
Question here is about the other ways to reduce the weight than the surgery that you're providing. Are there other healthier
Yeah,
ways that people can try to do before
yeah,
they come visit you?
yeah. Definitely, my recommendation would be for the patient is they have to try for at least 6 months doing some exercises, doing some healthy dieting. I'm not talking about the dieting. They should do a healthy dieting. They should cut their carbs and they should increase the protein content of their diet. And but if the BMI is more than 35, then I think this would be the ideal procedure. So if the BMI is less than 32.5, then definitely exercise or the dieting, healthy dieting can going to help you out.
Dr. Saggu, do you have a website that we can show our viewers?
Yeah, I have a website
Nick, can you
that is the
pull that up?
comsclinic.com.
Thank you.
Yeah,
So in your website, do you, I'm sure you give advice to the patients or people that are interested on other things that they can do to get their BMI to an appropriate level.
yes, yes. According to the BMI, we advise the patient whether you should go for the surgery or you should go for the exercise or you should go for the dieting. Yeah, depends on that BMI.
But you know
Yes.
what? I think
So
no matter
BMI
what,
calculation is very
go
important.
exactly. I think even if you go for the surgery, you still need to make these other practices happen. I've had that talk with my doctors. They said we could do this surgery for you, but maintaining your health is very, very important, right? So they need to continue doing some of these good
So I
diets.
mean, these are the different. Yeah,
Yes.
yeah.
Yeah.
So
And it looks like we have
they
a
all are the
site.
supportive after the surgery also.
Mhm. Yeah. Looks like we have a website that you can go visit. What's the
Yeah,
address of the website, Ankit?
It's www.comsclinic.com.
Clinic.com. Okay. And you can see it up on there. It looks like he also has some videos on that as
Yeah,
well. Okay.
and here
yeah.
the Coms Clinic means Center for Obesity and Metabolic Surgery.
Okay. Right. So
And
people
that's
can visit
very
the
interesting.
website.
There's
Yeah.
some interesting facts here about where you carry your weight. Like where I carry my weight is way different than where someone else does, but it makes a difference in what you're doing and what you need done. Is that correct, Dr. Saggu?
Yeah, because I mean, we need to do a complete body mass analysis in which we see how much fat is there, how much muscles are there, and what is your basic metabolic rate. Because some patients they have a low basal metabolic rate. So if we can fasten their basal metabolic rate, even then you can have a good results. So basically, we have to fasten the metabolism. If your metabolism is not good, you're going to put on your weight. So it is good to fasten your metabolism. So in the body mass analysis we see everything, and according to that my dietitian advise my patients. And if they have an experience of around 1 year of all these measures to get it done and there is no weight loss, then definitely they are the candidate for the surgery.
Hmm.
And sir,
Yep.
is obesity an heredity problem, or people take it by bad habit of food and or maybe munching?
So I say the obesity is a multifactorial disease. There are a lot of factors. Yes, heredity is one of the factors, because if I operate one member in the family and I operate only 4, 5, I operate other members of the family also. So in the family, they have 5, 6 patients. They are coming for the surgeries. Heredity is definitely there, and that we cannot say it's through the genes. You know, because the family environment is the same. If I am eating more carbs, my brother is also eating more carbs. My son is eating more carbs, right? If I'm not doing good exercises, my other family members, they are also not doing the exercises, good exercises. So through genes, yes, some, but moreover, the environment factor is the
The
Yep.
hereditary is also our disciplines that we pass down. It might not just be our DNA, but
great
it's truly
importance
our.
in the obesity, because the same environment, everybody is there. So the
Well, this is definitely an excellent website.
Yeah, it's an excellent website. Well, we're running out of time right now, but we do want to thank Dr. Singh Saggu and certainly Ankit and Kim for coming to the IBM TV channel and discussing a very important topic, which affects certainly 40% of the people in the United States, is obesity and being overweight. And we need to have more discussions on this and figure out a way we can help
Absolutely.
people
This
do
needs
this,
to be a
because
panel.
this needs to, yeah, this needs to
This
be
needs to be a
expanded
panel.
because it's a
Dr.
big
Saggu,
problem
when
here.
is your next visit to the U.S.?
Yes.
yeah, maybe, yeah, very shortly. So I'll see you there.
Okay. All right. Right. Yeah. We'd love to have you on a panel
Yeah,
regarding this at IBM TV, because
Keep us
it's a big
posted.
problem. There's no question about
Absolutely.
it. Right. And it seems to me that you're working on the great solution. So I'd like to thank our viewers and thank everybody for watching IBM TV, the Health Channel
Thank
with
you,
Ankit.
Ankit.
yeah,
Thank you,
Take
Dr.
care.
Saggu.
yeah. Thank you so much. Thank you so much.